out of these diagnoses, which diagnoses have a higher risk of developing an adverse effect from morphine? Thinking respiratory adverse effect, which is the most important. Liver cirrhosis, pneumonia, post-op hip replacement, or obstructive sleep apnea. Definitely the two that are respiratory, you will have you will have it in your target point. 2 and 4. Now, we've seen that so far, patient 4 has 2 conditions that places that patient in a high risk of adverse effect. Number 4, because of the age, elderly, and number 4, because of the diagnosis of obstructive sleep apnea. It's not only sleep apnea, but it is the obstructive type. Very interesting. Very interesting. So I really like 4 a lot. Now, some of you responded to the question because of the level of pain. For example, some of you thought the answer was 1 because it says severe pain. Some of you eliminated answer 4 because it says mild pain. But the question is not about pain relief. The question is not about which patient will you give morphine first. No, that's not the question. The question is about risk of adverse effect. So it's a totally different question. The patient that have the higher risk of developing an adverse effect of morphine is the patient that have more risk factor. Patient 4, elderly, 1 factor. Patient 4, of diagnosis, obstructive sleep apnea. So there you go. 2 risk factors that are very important to monitor and to look for risks of adverse effects. So the correct answer is answer number 4. Okay? Did you understand? Does that make sense to you? Let me know if that makes sense to you. All right. Very good. Okay. Now, we're going to be live again to practice more questions together. But I want to finish up by giving you instructions about how to join our raffle to win our 3-day fast track course. We have developed a fast track course that is 3 days training, only 3 days, every Saturday from 9 a.m. to 4 p.m., where we're going to cover these topics: delegation, prioritization, case studies, and standalone questions. With these 3 days, if you pay attention, 8 hours each day, 8 hours the first Saturday, 8 hours the second Saturday, and 8 hours the third Saturday. We're going to be teaching you prioritization, delegation, how to answer case study NCLEX style of questions with NCLEX strategies, and how to answer the standalone questions on the NCLEX. It's going to be an excellent training for you. It begins next Saturday, but I want to give an opportunity to some of you to have access to this awesome 3-day training for free.